Yes, ma'am. All right, can you tell me your name? Date of birth. Good job, good job, good job. Okay, I received some paperwork in that I wanted to come sit down and have a talk with you about. And it was about the heart failure. They say you wanted to speak with me about it to get a better understanding, have a teach about it, so that's what I'm here for, okay? Good. Okay, so heart failure is a chronic progressive condition in which the heart muscles is unable to pump enough blood to meet the body's needs for your blood and your oxygen. Understand? I'm gonna put it to you in a shorter term. Basically, it's your heart. It can't keep up with the overload of your body, what it's doing. And it could mess with, like, you can receive like kidney damage from your heart failure. It can require dialysis, something we don't want. And it can lead to a buildup of fluid that puts a lot of pressure on your liver. So basically, the heart failure could mess with all those main organs, which is your liver and your kidney. That's what we don't want. Any questions so far? Good question. Okay, your medical treatment. Okay, your medical treatment would be, I would say, you could eat less salt. If push comes to shove, you know, if it's too bad, they can give you a pacemaker or limit your fluid intake or give you a defibrillator. A defibrillator, yes, or a pacemaker, yes, ma'am. Well, good question. When your battery, it's time to change your battery, yes, ma'am. We'll change the battery in your pacemaker. Great question. The diagnosis, okay, the diagnosis, they'll give you a diagnostic test from like a chest x-ray where you can lay down flat or you stand up in which way, and they'll come in, they're going to do a chest x-ray of your chest. They'll give you a stress test also, like they'll get you on a treadmill or something, do a stress test, like you walk, and as you're walking, they're going to have you hooked up to these different things, monitoring your heart rate, or also they'll give you a blood test. The different medications you would probably be on, it would be like Diovan, Zestril, Carbidol. It'll be, you know, different ones. If when we decide that you're not, we see that you don't have any allergic reactions to those, something where best fits you. But my goal would be to, you know, I'm gonna do your diet modification and administer your correct medications for you. And also I'm gonna monitor your vital signs on a regular. When would you have to call the doctor, ER? I would say if you have a hard time trying to lie flat, that's a red flag immediately. Or if you get like a constant hacking cough or weight gain more than 5 pounds in a week. So we're going to put you on the schedule to get your weight monitored every week. So we'll let the restorative aid come around and put you on the weekly weight so we can watch your weight gain. Correct? Yes, ma'am. Correct. And different signs and symptoms of the heart failure, it would be like a dry cough, loss of appetite, water retention, like the swelling of your legs, your arms, the swelling of your body. That's different things. Correct. Yes, ma'am. Okay, you have another question? Okay, what is it? About CAD, the heart arrhythmias? Okay, that is, an arrhythmia describes an irregular heartbeat. So with that condition, a person's heart may beat too quickly, too slowly, too early, or with an irregular rhythm. Your heart got a constant beat. Yes, ma'am. So when it start doing either beating too slow or too fast or just, you know, I feel irregular. Correct. Medical treatment, if it's bradycardia, a patient can get a pacemaker. Tachycardia, a patient can receive a ventricular surgery, aneurysm surgery. Yes, ma'am. You can have all this. They have all kind of different surgery now and different device to help you with your heart. Yes, ma'am. Correct. Your diagnostic test would be like your blood, your urine, EKG, X-ray, or heart catheterization, different things like that. The medication would be like a Lidocaine, Flecainide. That's like your different medication that will put you on. But the Lidocaine, it can only be given through an IV. And they have one also called Toconide and a covert, and it's only given through an IV also. Yes, ma'am. And I would play a role in to support you in like dealing with your anxiety, your fear of potentially life-threatening situations. I'm going to treat your life-threatening and review information regarding your condition, your prognosis, your treatment regimen. That's what I'm going to come in place to do all that. Yes, ma'am. Signs and symptoms will be like if you're just sitting down and you get dizzy, you often get dizzy, chest pain, slow heart rate, weakness. When should you call the doctor? You should also call the doctor if you faint, chest pain, or weakness once again. Yes, ma'am. Correct. Yeah. Yes, ma'am. Yeah, another question? Okay. What's the, excuse me? A pericardial disease? Okay. That is an inflammation of the the pericardium. It's like a sac-like structure with two little thin layers of tissue that surround your heart. And they hold it in place to help it work. With a small amount of fluid, the layers separate. So there's less friction between them as the heart beats. It also can affect the kidneys. So, yes, ma'am. But the medical treatments, okay, the medical treatments for the pericardial disease can be to drain the fluid, open the layers, or remove the pericardium from around the heart. Yes, ma'am. How can they see if you have it? Okay, your diagnostic test would be a computed tomography scan of your chest, which is basically a CT scan, another big word for a CT scan, and also an MRI of the heart. And then they have it's a procedure that uses a needle to remove the fluid from that's around the heart also. Is aspirin a good medication? Yes, ma'am. Also, aspirin is a good medication. And colchicine is another good medication. Yes. The nursing interventions will be to provide basically your bedside commode and have it right on the side of you. Keep you placed in the upright position and monitor your pain level and evaluate your pain level. I'm going to evaluate your pain level like from a 0 to 10. I'm going to ask you, what's your pain level? You're telling me if it's 1, 2, 3, 4, 5, all the way up to 10. 1 is okay. You know, you're going to find up to 10, you're in a lot of pain. Yes. You call a doctor when you have chest pain, symptoms of shock, and trouble breathing, when you're not breathing. The signs and symptoms. Your signs and symptoms will be increased heart rate or pain in the upper right abdomen. Yes. Yes. Okay. Well, if you think of any other questions, feel free to ask me. All right. Thank you. Have a great day.